This meeting is now being recorded.
Hi, everyone. Thank you for joining us for the Lunch and Learn webinar. I'm your host, Donna Karras, and today's webinar is Ringing in the Ears, Managing Tinnitus with audiologist Dr. Christy Albers from Stillwater Medical Group. Two things to tell you first before we get started. First, I am recording the webinar, and I will send out the recording to everyone later this week. And second, look at the top of your screen for the Q&A tab. You can click on that and enter a question at any time during the webinar. We'll have time at the end for Dr. Albers to answer your questions. So now let me turn this over to Dr. Albers.
Thanks, Donna, and thank you to all of you logging in and spending your lunch hour with us. We really do appreciate it. As Donna said, the topic today is ringing in the ears, managing tinnitus. Tinnitus is the pronunciation that you will hear most healthcare providers using. A lot of my patients also call it tinnitus. Both of those are acceptable pronunciations. We do get that question a lot. How do you actually pronounce that? So what is tinnitus? Tinnitus is the perception of sound when no other sound is present. It's an internally generated sound. Although commonly referred to as ringing in the ears, tinnitus actually can be perceived as many different sounds. Buzzing, roaring, hissing, whistling, whooshing, and clicking are common ones. I sometimes will hear cricket sounds that people will tell me. So anytime you're hearing any sort of sound, it would be classified as tinnitus. Tinnitus sounds might be soft, loud, or actually fluctuate. Sometimes people tell us that it sounds like it's with their heartbeat, and I will get back to that later in the presentation. Tinnitus could be constant. It can also be intermittent. Some people say it comes and goes. Some of my patients tell me they hear it more pronounced at night, that they go about their day, they don't hear it, and then they sit down to relax, and there all of a sudden is the ringing in their ears. Tinnitus may also be in one ear or both ears. There's really no right or wrong in any of these sounds or how often you're hearing it or which ear. If you're hearing it in one ear, it still is classified as tinnitus. According to the American Tinnitus Association, which is an excellent resource for all patients to utilize in regards to tinnitus, over 45 million Americans report some form of tinnitus. That's a significant amount of Americans having ringing in their ears. It is more common in males than females, and when we look at the causes, you'll understand why that is. High-risk groups for tinnitus, senior citizens, active military and veterans. In fact, currently it is one of the top disabilities reported by returning veterans from overseas. Even with the advancements of hearing protection, they are still experiencing it from blasts and explosions that they may be exposed to. Persons who have worked in noisy environments such as construction, musicians. I think you will find more and more professional musicians are protecting their hearing with in-the-ear monitors. However, many do not, and they are very high risk. Persons who ride motorsports and hunters, and persons with behavioral health concerns. You can see a very common factor in this high-risk group is persons exposed to high levels of noise. That continues to be one of the top causes, and we'll get in more to causes here in a few slides. One thing I really wanted to stress is that tinnitus is not a disease. It's actually a symptom of an underlying health condition. In most cases, it's a reaction in the brain associated with damage in the ear or auditory system. When I say auditory system, that includes not only your inner ear, the parts of our ear that we hear with, but also the auditory nerve pathway that is sending the sound into our brain, into the cognitive areas where we perceive the sound to know what we're hearing. So causes. Hearing loss is highly correlated with tinnitus. If any of you have gone in to see your physician and mentioned it, that's typically the first thing a physician will say is, you know, you might have hearing loss, you should have your hearing evaluated. Hearing loss is a result of damage to our auditory system, and so the same damage that caused the hearing loss is likely contributing to the tinnitus. So it can be age-related hearing loss, noise-induced, as we saw in the demographics. A lot of people exposed to noise experience tinnitus. It can also be a conductive hearing loss. There's many different types of hearing loss. One is conductive in that it's in your middle ear. We have a middle ear space with tiny bones, and if that part of our hearing system isn't working, people do perceive tinnitus. And then obviously age-related and noise-induced hearing loss is nerve-type loss inside the inner ear. Middle ear obstructions such as Thurman, which is known as wax, fluid in the ear, which can be caused by allergies or an infection. Pressure, if you've ever landed on an airplane and experienced intense pressure, you've likely heard tinnitus at that time. And otosclerosis is a disease of the middle ear that causes our bones to become hardened and overcalcify. And so a lot of persons with otosclerosis report tinnitus. Cardiovascular disease. Our inner ears are bathed in our cardiovascular system. So persons with high blood pressure or heart disease, tinnitus is highly correlated with that. If there's increased pressure in our cardiovascular system, it could cause pressure of our inner ear and become tinnitus for some people. Ototoxic medications. There are medications that can be damaging to our inner ear. Some chemotherapy medications, some high-dose antibiotics. Typically, if you're going to receive one of those, your physician will tell you this could be toxic to your inner ear. You could have tinnitus or hearing loss. And typically, these are life-saving type medications, and they are given despite the known risk of causing ringing in the ears or hearing loss. Head and neck trauma, and TBI stands for traumatic brain injury. Persons who have received trauma to their head or neck often have long-lasting inflammation and damage inside their brain or spinal system. All of that could contribute to tinnitus. TMJ is a common issue with our joint and our jaw. It's located right by our ear. That can contribute to ringing in the ears. Other diseases such as Meniere's, which is a disease of the inner ear, metabolic disorders. Metabolic disorders are things such as thyroid disease, some autoimmune diseases. They have been highly correlated with tinnitus. Persons with brain tumors, if a tumor is located near your auditory nerve and causing pressure, it could be caused by the tumor. And then obviously we've mentioned noise exposure. If anybody's ever gone to a loud concert and left with their ears ringing, not uncommon. Our inner ears are built and designed to help protect against loud noise, but when we've exceeded our innate ability to protect ourselves, our tiny thousands of hair cells on our inner ear getting blasted by sound don't like it too much, and they can overfire and cause tinnitus after we've been exposed to loud sounds. It is a sign you've received some damage that may not show up in the form of hearing loss until later in life, but it could cause temporary tinnitus or permanent tinnitus. So what should you do if you're experiencing tinnitus? We say the first step is to discuss the onset with your primary care physician. They're going to rule out that your ears are impacted with wax or that you're potentially having any middle ear concerns such as chronic eustachian tube dysfunction or middle ear fluid. They're going to also ask, was this a gradual or acute onset? Did you just wake up in the morning with ringing? That question's important because if it's something that you've kind of gradually been noticing throughout your life, it would likely be something like hearing loss or chronic noise exposure that is contributing to it. If it's acute or you just woke up in the morning, it could be a sign something else is going on and we'd want to address it more promptly than if it was gradual. They're going to review your health and medications. Was there a change in general health at the time of onset? Was there, did you start a new medication and all of a sudden tinnitus started? Those are all factors we would want to rule out. If the tinnitus goes away, it was likely caused by something that wasn't chronic or serious. But if it's something that's staying and bothering you and is chronic, your physician will likely refer you to an audiologist. You can self-refer as well, but I think that first step in seeing your physician can rule out some things that maybe can be taken care of that could be contributing to it. If you are seen by an audiologist, so audiologists are highly trained healthcare professionals. Most have doctorate degrees, and our specialty is the hearing, auditory, and balance systems. So that is kind of the first line that physicians will refer to if someone is having tinnitus. We will perform a thorough case history. Again, review. Have you had head and neck trauma? Is there a family history of hearing loss? Have you been exposed to noise? Any changes in medication, health care, your overall health, etc.? We will do a complete audiological evaluation, which is fancy word for hearing evaluation. We'll assess your middle ear function, how your eardrum and middle ear bones are functioning, and then also your inner ear hearing sensitivity. This will really give us a visual picture into what's occurring in your inner ear in regards to our hearing, and that can also often lead to explanations as to why you may be experiencing tinnitus. Based on the results that we find in our evaluation, you possibly would be further referred to an otolaryngologist, also known as an ear, nose, and throat doctor, who we work quite closely with here at Stillwater Medical Group. Reasons for referral would be, as I mentioned previously, if your tinnitus is pulsing with your heartbeat, we would refer you to the otolaryngologist for further head and neck evaluation, just to determine is there anything in the cardiovascular system. If there's a difference between your two ears, or if you're hearing the ringing in just one ear, we would want them to evaluate you. Was it acute? Are you having dizziness? All sorts of different reasons why we would possibly refer you on to them. I also tell my patients, if you're on a long list of prescription medications, I often will refer back to the primary care or maybe the managing physician. If you're seeing someone in a specialty area who's managing a particular medication and you really do feel the onset correlated with a change in that medication, they may be able to prescribe something different that could help that health problem and not be causing the tinnitus. In addition, drug reactions together are very common in causing tinnitus, and the pharmacist where you go for all your medications is going to be very knowledgeable in being able to look at the list of medications you're on and know, could there be a drug interaction occurring? If they feel there could be, then they're going to obviously alert your physician and talk about some options that you could be changed to. So that is definitely something that we do often refer people to, and pharmacists are always willing to sit down and review. When you start taking a lot of different medications by different physicians, they can have some interactions. Here at our clinic, we have a snapshot typically of all your medications you're on. So your physician is also very knowledgeable on some of those reactions as well. If tinnitus is severe enough and affecting a person's daily quality of life. If this is something that is causing you to not want to leave the house, causing depression, anxiety, there may be further referrals for those types of patients. In the audiology department, there are questionnaires we can administer to see how much it's affecting your quality of life. Based on that, we will make appropriate management and treatment recommendations, which we're going to go over here in a little bit. We may refer you back to your primary care, the ENT, or behavioral health if this is causing you anxiety and or depression. We want to make sure that all of those issues are managed properly as well so that we can then focus on managing the tinnitus. And we'll talk more about some of those pharmacology treatments. So getting into the management and treatment, I'm sure some of you listening have been told, sorry, there's nothing you can do about it. You're just going to have to learn to live with it. Part of that is true and part of it's not. Again, there is no proven cure for most cases of tinnitus because the majority of cases are caused by nerve hearing loss. Once you have nerve hearing loss, it is typically permanent. And so when tinnitus is correlated to that hearing loss, it likely is permanent as well. So when we see patients with tinnitus who are seeking treatment and management, our objective isn't to get rid of the tinnitus because we know we can't do that, but it is to reduce the perceived burden, allowing patients to improve comfort and quality of life. So anytime I see someone with ringing in their ears or buzzing, I know they've been told by someone there's nothing you can do about it, and it's very false. And I feel like just telling patients that I see the relief in them, the reduce of the stress, just knowing there are actually treatments. There are no cures. We can't get rid of it, but there are definitely ways we can manage it. We do have excellent tools available to help manage it. These tools will reduce the perceived intensity. So that's the goal in most of our management options is, okay, we can't get rid of that ringing, but let's figure out how we can reduce how much you're perceiving it. We allow patients to be less aware of the sound, and their brain becomes retrained to no longer focus on the tinnitus. Tinnitus therapy and chronic pain therapy are actually quite similar. It's all about retraining our brain to not focus on the issue to reduce that perceived burden. And when we do this, it can lead to improved quality of life, and many patients will say, I know it's there, but it no longer bothers me. So what are some of our treatment options we have for people? Well, for persons with hearing loss, after we've done the hearing evaluation, if you have enough hearing loss to benefit from a hearing aid, the one thing we stress is this not only will improve your ability to communicate and hear, it's going to help us manage your tinnitus. By reintroducing amplification in the regions a person has hearing loss, they typically find that that amplification does naturally mask out the ringing. The area we have hearing loss is often the pitch of the perceived ringing in the ears. And so by bringing in that amplification, that sound awareness in our environment, the tinnitus typically becomes less noticeable. So many of my hearing aid patients, that's the first thing they notice is they know it's there, but they're no longer hearing it throughout the day while they're wearing their hearing aids. And just over time, they are naturally, their brain is retrained to no longer think and focus on that ringing. They take their hearing aids out at night, and it's still there, but it doesn't seem to be as loud as it once was. So this is a very natural way to treat the tinnitus, and the benefit of it is we're also treating hearing loss. For those who wear hearing aids and are still hearing their tinnitus, we now have tools built into hearing aids that can actually mask the tinnitus more. We can activate them, the sounds, in maybe a particular special program for you, or maybe in your everyday listening program. The sounds can be nature sounds, different types of white or pink noise, and we have a lot of ways to customize it to each patient based on what they're hearing. So the major hearing aid companies we are dealing with at our clinic all have that built in now, which is very, very nice for us. For persons with normal hearing, we will often recommend sound generators. So a wearable sound generator is looks like a hearing aid, but instead of providing amplification, it's playing a masking sound in your ear all day long. And we, again, have a wide range of sounds that we can choose from that are comforting, relaxing, and obviously mask the tinnitus. The goal is that we don't completely mask the tinnitus, but to retrain the brain to not focus on it, we do mask the majority of it. And over time, most patients end up having us continually turn down the maskers because their brain is becoming retrained. Also, there are tabletop sound generators. A lot of my patients use this at night. A lot of people don't hear their ringing until the evening when they're fatigued and tired and it's quiet in their surroundings. And so there are a lot of different options you can buy to put near your bedside. Also, smartphones. There are a lot of really great tinnitus noise apps to use on your smartphone that you can play different types of sounds. So people do find those beneficial. Non-sound treatment options. The first is counseling and behavioral therapy, helping people learn to relax, to work with the sound treatment. Possibly, sometimes counseling is done in conjunction with that. Pharmacology options. This would be like an anti-anxiety medication or antidepressant. This does just help reduce the stress. Stress can induce and cause tinnitus to get louder. So by treating the behavioral health concerns that could be, they're not causing the ringing, but they can actually cause the ringing to get louder if you're very stressed out about it. We have found these to be quite beneficial, and that's where we would refer you back to your physician or your nose and throat doctor for those. Many of my patients practice general wellness, yoga, meditation, chiropractor care. We are fully supportive of some of these options to reduce stress, which leads to good cardiovascular health, which can help just naturally reduce the intensity of someone's tinnitus. The chiropractic care, if someone's had some spinal issues and there's inflammation in the neck and head, I have patients who do feel their tinnitus is reduced by keeping that alignment in place. If someone with severe TMJ, we do refer for TMJ treatment. There are some dentists that provide TMJ treatment that can help reduce swelling and inflammation that could be contributing to the ringing. And I last want to caution on vitamins and supplements that are advertised to cure tinnitus. None of these have been proven to do so. In fact, they're actually quite scary for the public to be taking. They are not regulated by the FDA. They can interact with prescription medications. There is a professor who specializes in this, and I was at a talk last year, and there are some studies that have shown actually some of these vitamins and supplements advertised to treat tinnitus have caused it to get worse. So we really do we caution our patients from using them because none of them have been proven scientifically to help. Tinnitus prevention. For those who don't have tinnitus yet, the best way to prevent getting it, so this is someone, musician, or if you have a loved one working in construction or noise, hearing protection is one of the best ways to prevent it. Noise is one of the leading causes of ringing in the ears, and by preventing noise exposure and damage to our inner ear, you can prevent ringing in the ears. Also, a healthy diet, exercise, and lifestyle. You wouldn't think cardiovascular health would be correlated to hearing loss and ringing, but there are plenty of studies that have correlated poor cardiovascular health with hearing loss and tinnitus. And so leading a healthy lifestyle can help possibly prevent and relieve some of those symptoms. Many of my patients with tinnitus tell me they have triggers, diet triggers. Often it's caffeine, alcohol. So those are some of the things we will talk about when we see you. Is there something that you know, oh, every time I eat that, every time I drink too much coffee or maybe an energy drink, I get the ringing in my ears. Those are obviously signs your body can't tolerate those type of stimulants or possibly some foods. And so we do work with our patients to try to identify if there's any triggers that can make it worse. Reducing stress and anxiety, as I mentioned before, is a big one. Stress does really horrible things to our body, and it can exacerbate the tinnitus in your ears. It can induce it. So it's a vicious cycle sometimes with ringing in the ears to know which was causing what. We know they're always correlated typically. So our goal is to treat them both to manage them. And by reducing the perceived burden of tinnitus, that can lead to reduced stress and anxiety. By reducing our stress and anxiety, it can often lead to reduced burden felt by the ringing in the ears. These are two excellent sources and resources I wanted to share with you. Hands down, the American Tinnitus Association is the go-to resource for tinnitus. There is, as you know, searching the internet, so much information, good and bad, on any kind of health topic. And I'll often have patients come in and tell me they read about something with tinnitus, and it was unfortunately not a great resource. And so to know all the different treatments, which I reviewed most today, and what's happening in research, I would highly recommend visiting ATA.org. There are some new research that's occurring about new treatments. It's some neuro stimulation treatments for people with severe tinnitus, but again, that's all still in the research phase. But I have no doubt we will see some advancements in the years to come. And by being a member of ATA, it does help fund some of that research. And then obviously the government website is very trustworthy in laying out some of the things we talked about today. So those would both be excellent sources for you to have. Here at Stillwater Medical Group, we have a team of audiologists. We all see and treat tinnitus patients. That's myself at the top, and then Dr. Bizdak, Kokendorfer, and Dr. Morrison. We all work to help our patients with that perceived benefit and find the right solution for you. And we have an excellent team of ear, nose, and throat doctors as well, who we work right along in the same hallway. So if we have to refer to them, if your primary care doctor is in this clinic, obviously we have really great communication with them as well, but can communicate with physicians outside our clinic as well. Okay, let's take a peek at some of your questions. Thanks for being patient with those. Okay, looks like someone is talking about Meniere's. So Meniere's is a disease I mentioned of the inner ear. It's actually a disease that causes hydrops, which are kind of like air bubbles in your inner ear to occur, and it will often lead to hearing loss, balance issues such as vertigo, and can cause ringing. The hearing loss, if you have been diagnosed with Meniere's, likely is permanent, and the Meniere's causes that nerve damage. Most of our Meniere's patients do wear hearing aids. So the question was, can it not be helped with hearing aids? So I would say, definitely come see us for a full hearing evaluation. We can give you our opinion on your hearing loss, if you'd benefit from hearing aids, and then discuss the ringing that you're hearing as well. Is this typically covered by insurance? most insurances cover a hearing evaluation annually. Persons on Medicare do require a referral from your managing primary Medicare physician. But that is something you would need to check with your insurance company. Obviously, with high deductible plans, you would still have to pay your portion of that. But your insurance company is the best resource for that to know if you need a referral or not. If there are any other questions, feel free to go up top to your screen and click the Q&A and type in your question, and it will be sent to us. Also, our number is listed on this page, and that's our direct extension to the audiology department to schedule a hearing evaluation. If I would just be sure to mention that you do have ringing in the ears. That's always good for us to know beforehand. All right. There's one more question here. I'm going to let Donna address the question in regards to copies of slides and recording when we're done here. There was a comment from a pediatric OT, and you use programs such as integrated listening systems and other modified music programs, and was wondering if this has been researched for tinnitus or something. That's a great question. Some of the treatments for tinnitus are actually music programs. One of the manufacturers is Neuromonics, and we are not fitting Neuromonics at this time, and that is ideal for people with normal hearing who are experiencing severe tinnitus and need to go through a formal tinnitus treatment. Some of the hearing aid companies we work with have settings where we can play different music samples. So yes, definitely any music program music has been shown to help with tinnitus, not only reduce stress and anxiety, provide comfort, but then some of our products do provide music as samples to mask the tinnitus. I hope I answered your question. You can try to contact me directly if you need more information on that. Question on, does acupuncture help tinnitus severity? Again, I mentioned chiropractic care. I should have put acupuncture. That is something I will mention to patients as a alternative treatment, definitely. Acupuncture, I don't know if it's necessarily been studied scientifically, more anecdotally, but we do hear from patients that they feel the acupuncture can relieve some of that stress and anxiety and just help in the overall treatment of trying to not focus on the ringing. If you have a lot of head and neck tension around your ear, relieving some of that can help reduce the tinnitus. So I always tell my patients, if you've done acupuncture before, it is definitely worth mentioning to your therapist and trying. It's not going to cause you any harm or cause it to get worse. So, great question. Okay, if there are no further questions, I'm going to hand the microphone back to Donna, but I just want to thank you again for attending and learning about managing tinnitus with me today.
Thank you, Dr. Albers. That was really informative. Just a couple of things to share, and then we have another question. I'll send it back to her. We have another webinar next month on finding relief with looking at asthma treatments, and you're welcome to register for that or share that with other people that are interested. And one of the questions was, how did we get copies of the slides and the recording? I will get the recording either later today or tomorrow, and I'll send out an email to everyone with the slides and the recording. And let me turn it over to Dr. Albers for, there was another question. Oh, it's just a thank you. And if that's all the questions, we'll just give one more minute for questions, and then we'll sign off for today. And I want to thank everyone for joining us today. And again, thank you, and I'll send out an email tomorrow with the recording. So thanks again for joining us.